I'm getting an out-of-state call, and I hate getting any out-of-state calls. I hate getting calls, period. With that being said, let me get into today's video. Today, we are doing a little Hannah reacts. I want to start off by saying, if I don't like and comment, if I don't reply to you and comment, I need you to understand. I see these comments, I see these suggestions, even if you guys are not wording them in very polite ways. I see them, I take them into account, and from here, probably here on out, Hannah reacts are going to look a little different, where during the video you will not have any audio and commentary from me. I don't know if that's preferred, but I know I posted one at the end of 2023 that didn't have any like commentary audio while the video was going, and then I posted one at the beginning of 2024 that also didn't have any commentary audio going. Don't know if we like that. Don't know anyone's opinions because I didn't get any feedback on it. With that being said, we are doing a Hannah reacts. I'm going to get the video set up and then we're going to talk a little bit about it. Get into the video. I kind of want to explain what I'm also going to be doing different with these here on out. I am going to be linking the video we're watching down below, so you could also go and show support to the creator of these videos. I don't monetize these videos, so I don't get any funding off of them, but if you do want to go give, you know, the view to the original creator, I'm going to link them down below. You could show them some love in whatever way you feel. With that being said, we are going to watch the surgery that should have never happened. The case of Michael Skolnik. I butchered it. This is by Petal Palmer. Like I said, this video link will be linked down below, so you could go show them some love. With that being said, let me get this set up and let's start watching.
Medical nightmare that led to a new law here in Colorado.
To be careful of who you trust with your health.
Mistakes that caused someone their life.
And told his parents they needed to operate, and soon.
$4.5 million medical nightmare.
Doctors will have to register any problems from their past.
Any malpractice cases that they have lost or even settled.
Ended when Michael's life did.
He went through 32 months of hell.
It's the beginning of the end for me.
Everyone should know about a doctor's mistakes.
I trusted him. I did.
You overlook a lot of things when you're that scared.
This all shouldn't have happened.
Today, we are going to be discussing the case of Michael Skolnik. Michael was a nursing student and a part-time EMT. You would have honestly thought that his issues would have been an easy fix, but what his healthcare team did to him rather turned out to be possibly one of the most botched unfolding of procedures. And because of these procedures, Michael would spend the rest of his few years of life suffering before he passed away. But what makes this case even worse was that they soon discovered that Michael's surgeon was holding a very big secret from them. And it was so bad, they needed to create a law to avoid this from happening to someone else. This case was actually suggested by a subscriber, Vit Moore. I am so sorry if I didn't pronounce your name right, but thank you so much for suggesting this case. And just to introduce myself, my name is Petal Palmer, and on this channel I post anything involving medical mysteries and crime. If that sounds interesting to you, please consider subscribing if you like it. Alright, let's get into this case. Michael Jared Skolnik was born near Denver, Colorado on March 15th, 1979. He was the only child to parents Patty and David Skolnik. But despite being the only child, his parents would describe him as having so many interests and hobbies, it almost felt like there were two children. As a kid, Michael was very active. He stayed involved in anything he can get his hands in, really. Whenever his dad was out doing any sort of handiwork, Michael was always out alongside to help him. In particular, one thing that's pretty cool is that he'd often spend time in the garage rebuilding cars with his dad. And he also loved the water. Anytime it was summer, Michael would get so excited spending time out on the boat with his uncle. And as a kid, he was quite the mischievous little prankster. When he was 7, he thought it would be the funniest April Fool's prank to break an egg on Patty's face. So he grabs this egg and smacks it on his mom's face, and she couldn't help but just laugh as her little 7-year-old son is in front of her cracking up over this broken egg. But that has just truly always been Michael. He was somebody who wanted to make people laugh. He wanted others to feel good. His father would say he was the kid who would stand up for somebody anytime they were being picked on or bullied, regardless regardless if he knew them at all. Michael just had so much joy in being able to help others, and this was a trait he possessed from as early as he could remember. And with this genuine compassion and care he had for others, it was no surprise that Michael wanted to go to nursing school with hopes of becoming a registered nurse. And he actually did nursing school while working as an EMT. With this job, Michael started gaining so much experience in the healthcare field. He started to learn a variety of different skills, critical procedures, and he was learning how to truly help somebody in a life-threatening situation. It would have been a normal day for him to provide first aid treatment for patients needing admission in the hospital. And this role was perfect for Michael because he was able to do what he loved doing, which was helping others while being in a healthcare environment. And nursing school was something he excelled at. It's no secret that nursing is a difficult subject to study, but that was Michael's passion, and he was going to make sure he did all his classes and learned everything necessary to become the best nurse he possibly could. Something in particular that really stuck with Patty was Michael's profound outlook on life. She actually recalled a moment when Michael was 13 years old and they were discussing the topic of religion and God. Michael was telling her how he doesn't believe in God and that he doesn't really feel like a very religious person. And so Patty then asked him what he would think if he found out that there was a God. And Michael actually replied something along the lines of, well, if God is real and he's supposed to be forgiving, he will forgive me for not believing in him. This moment just always stuck with Patty because it really showed that even as a 13-year-old, Michael just had this deep way of thinking, and this was something she seriously admired so much about him. But this story would take a tragic turn when Michael had started encountering some concerning situations regarding his health. On the morning of September 17th, 2001, Michael had woken up and made his way out the door to head to his classes. And after he went to all of his classes, he headed home to spend the rest of the day just relaxing on this Monday afternoon. But after a few hours had gone by, all of a sudden, Michael would suddenly collapse. And just a short period of time would go by when Michael starts waking up. Now, while this would be a very startling moment for anybody, especially presumably a healthy 22-year-old guy, Michael was actually not shocked at all because this had actually been going on for the past few months. There had been another instance 3 months prior when he had actually lost consciousness for the very first time. But this initial incident wasn't too concerning for him because he had no other symptoms indicating that there was something wrong. He must have initially thought that the fainting had something to do with maybe being dehydrated or standing up too quickly, something that must have been easy for him to treat at home. It would be finally after this second occurrence when Michael would say, okay, you know what? Something is wrong. I need to go see a doctor about this. And it was at this point he called his parents and he told them, hey, I just fainted again. I think I need to go to the ER to go see a physician. And so his parents would then subsequently head home, pick Michael up, and they would shortly leave to arrive at the local hospital's emergency department. When Michael gets checked into a room, he would then be met with a doctor, and the doctor would initially start by going over Michael's health history and asking him important questions about his symptoms and any medications he was taking. And it was at this point Michael had told him, yeah, I'm currently on a medication called Wellbutrin. Now, Wellbutrin is also known as bupropion, and this is an antidepressant often used to treat conditions such as depression, but this medication could also be used to help treat those who are trying to quit smoking. And in this case, that is what Michael was using it for. He was using Wellbutrin to help quit smoking. And it would be after he tells him this when the doctor would tell Michael, look, I think the reason you might have fainted is because of the Wellbutrin, as fainting is one of the possible side effects of this drug. So at this point, they would then order for Michael to do a spinal tap, and a spinal tap is a procedure where they use a long needle to get some cerebrospinal fluid out of your back in order to test it to see if there's something wrong with your brain. So after he gets this done and they wait for the results, the doctor would come back and tell them that the results were actually inconclusive. It was at this point the doctor said to them, look, I'm going to order you a CT scan, and that should hopefully help see what may be causing the problem. And when the results had came back, to their hope, they had fortunately gotten a little more insight on what could have been possibly going wrong, because in his CT scan, they'd find that they looked to be a small little round dot in his brain. And this dot was consistent with what they would call a colloid cyst. To be exact, in his chart, the radiologist had wrote that there was a tiny round hyperdensity, which may represent a very small colloid cyst, which does not appear to create any ventricular obstruction at this time. Recommended further evaluation with MRI. And the doctor would reassure them that if this was a colloid cyst, it was likely something he was just born with and that there was nothing they should be concerned about regarding the cyst. However, they started thinking that Michael might have instead been suffering from a seizure disorder. And because this radiologist had recommended an MRI to get a more in-depth view, it would be the next day when Michael would go in and get an MRI done on his head. And again, like the day before, they would essentially say the exact same thing. Again, noted and without change is a small 4.2 millimeter area, most likely represents a colloid cyst, which is causing no ventricular obstruction. This is good news. There's no mystery illness. Doctors know exactly what's wrong, and surely they should be working on a treatment plan to help deal with the small cyst. And so the family would head home from the ER, and just to be safe, of course, Patty would start trying to contact different physicians to get a second opinion. She would start by reaching out to Michael's primary care physician to let him know about the situation, and then she would go on to get in contact with a nearby neurosurgeon we will be referring to as Dr. M. Dr. M was an experienced neurosurgeon. He had been working in the medical field for over 10 years at this point. There's a lot more information I found on him, but you'll see why. I'll be getting into that a little bit later. It would be during this phone call with Dr. M when he would hit Patty with the most alarming news that would soon tragically change this family's lives. On this phone call, Dr. M had straight up just told Patty that Michael's condition was so bad he needed to be immediately admitted into the ICU at the nearby community hospital. He would go on to tell her that they are so lucky that she contacted him because if they didn't, Michael could have seriously died. He told her that colloid cysts are just so dangerous and just all these things she should be concerned about. Patty had no time to even think about what he was saying. She just needed to immediately tell Michael and David what was going on. So after what must have felt like forever while packing, the family shortly left on their way to get to the Valley View Hospital. When they arrived, Michael was checked in, and shortly after, the staff would enter his room and let them know that they needed to do their own CT scan and that they will proceed from there. So once Michael gets the scan done and they wait for the results, Dr. M would come into his room, introduce himself, and then he would get into the results from the CT scan. So he pulls out the paper with the image of the scan on it, and they were shocked with what he said to them, because he would inform them that this cyst was apparently so bad and that the ventricles in Michael's brain were so enlarged and he just had so much fluid that there was just so much pressure in his head and that there was in fact major obstruction. Contrastingly different to what the ER doctors told him. And Dr. M would go on to tell them that in order to treat this, they would need to immediately insert a ventricular drain in Michael's head to drain the fluid and decrease this pressure. And he'd follow this by saying that Michael would also need to have a brain surgery after this drain placement just within the next few days. But while he is saying this, he is just talking about it like it's the most nonchalant procedure ever. He was telling them that it was no big deal. Michael would be out within 6 days. He's done hundreds of these, and that it would be honestly just a walk in the park to get this done. So while this was shocking news to the family because they were fully under the impression that this cyst wasn't anything that seemed to be an emergent issue, Patty was actually very grateful at this moment because she was just elated that this doctor, this neurosurgeon who must be very skilled in this field of medicine, had noticed something that the ER doctors didn't. Had they not gone to see him, they would have never discovered how bad Michael's condition truly was. She was just glad to have this doctor who wanted to save her child's life. So at this point, Patty, David, and Michael would start discussing their thoughts on what they should do, presumably just talking about how they felt about it, whether Michael was comfortable, if they thought this was a good decision. They were making sure that they as a family could just feel content in this decision for Michael to follow through with this drain placement. They would ask Dr. M a series of questions to trying to determine if this was a necessary decision. And Dr. M would reply that this procedure is what they needed to do. Everything that is happening or everything that would happen is essential to saving Michael's life. If he doesn't get this fluid drained from his head, there could be some serious consequences. So after some careful deliberation, they all unanimously decided that this drain placement would be the best course of action in order to save Michael. Dr. M would then leave the room to get the paperwork, and when he came back, Michael would then sign the forms consenting to getting this drain placed. And Dr. M would continue to reassure them that this was just a simple procedure and that there was nothing to be worried about. This really helped Patty and David feel a bit more relaxed on the procedure they knew was coming. Shortly after this conversation, they would then request that Patty and David leave the room so they could start preparing Michael for this operation. But it was soon after this point when the family would be absolutely blindsided by what Dr. M decided to do. They were under the impression that Michael would be brought to an operating room where they would use specific accuracy-based equipment. But what they soon found out was that this operation was rather going to be in Michael's room, done bedside, and performed using a hand drill. And this was when red flags first started going off for the family. The concerns would just grow even worse because it was not too shortly after this when Michael's procedure began going left. At some point during this drain placement, Patty and David started seeing staff members flooding in and out of Michael's room. So obviously concerned, when one of the nurses walked out of his room, the parents quickly asked, like, hey, what's going on? Is everything okay? And this nurse would tell them, yeah, like the doctor just gave Michael too much sedation, so we had to help him breathe. But he's looking much more stable now. And at some point, Dr. M had finally exited the room and David quickly approached him and confirmed, hey, did Michael arrest? And Dr. M just replied, who told you that? At this time, this didn't really seem like a red flag for the parents because they were more so concerned with just getting in that room to see Michael. But looking back at it, this reply was just odd and honestly kind of rude. And finally, when they were allowed into his room, they look at Michael and he is just fully unconscious under sedation. Dr. M would again tell them that there was just too much fluid in Michael's head, but what he followed this with was something that made them panic because it was later that night when he came into Michael's room and he told Patty and David, I need to operate in the next 48 hours or Michael will die. Michael's condition was so bad, he would need to have an emergency brain surgery in order to save his life. In this moment, Patty and David must have been absolutely terrified because here they were, after arriving at the hospital 48 hours ago, and now they're being told that in the exact same time frame of 48 hours, if they don't get this procedure done, their only son, Michael, would be gone. So of course, frantically, they started trying to figure out what they possibly could do to ensure that not only Michael got the best possible care, but that he would be able to do so in this very short time frame. Time was literally ticking. This doctor had convinced them that if they wanted their son to stay alive, there were no possible delays they could make. And Dr. M would honestly just try his best to help them feel at ease. He would even tell them that this was actually a very simple operation. He said that they would be using equipment that had microscopic pinpointing accuracy, and all they needed to do was simply open up the lobes, grab the cyst, and take it out. But even with all of the reassurance, Patty and David were just not able to think straight. Their son is unconscious after stopping breathing earlier in the day, and now they're being told that if he didn't get this surgery done soon, Michael would be gone forever. And in situations like these, when you know that if you don't act quickly, that something so traumatic can happen, it's extremely hard to think or even process things. Here's an authority figure, a trusted doctor, a neurosurgeon, telling them that all of this needed to happen in order to save their son's life. And while they're obviously nodding and seeming to be engaged in this conversation, they're obviously very anxious and could only think about what would soon happen to their son and what would happen if they don't make a quick decision. But when they would get home, they would again be hit with some shocking news that they were not expecting. Because when they opened their door, turned on their lights, and headed inside their home, they would notice that there was a letter in the fax machine. And when they went to the fax machine to check this letter, they would see that they got a note from their primary care physician, or PCP. And it was when they started reading this letter that their hearts must have absolutely dropped. Because in this letter, their PCP would tell them that Michael's cyst was actually just fine. There was nothing regarding the cyst that was causing him any sort of issues. It was a benign cyst. He would write in this letter, quote, "It is benign and will probably never grow or change. We will do an MRI in 8 to 12 months, still get EEG, call me." He told them that they should not do anything. And all they had to do was revisit him in a few months to get an MRI to just make sure everything was all good. He was basically telling them exactly what the ER doctors had been saying, that if this is a colloid cyst, it seems to not be doing anything and Michael should overall be just fine. So at this point, Patty and David just had so much new information to process, and Patty was just itching to get to the hospital the next day to show Dr. M this letter. It would be that next morning on September 20th when they woke up, got ready, and headed down to the hospital. And the first thing Patty made sure to do was show this to Dr. M, the letter she received from their PCP. So she gets out the letter, which she made sure to highlight with rubber bands, and as soon as she saw Dr. M, she immediately whipped it out and said, "Look, this is what our doctor had told us. It seems that everything was fine with Michael." But he would just say to them, This is a primary care physician. I'm a neurosurgeon. Just essentially saying, he's just a PCP, you're just a mom, you should listen to me, what this smart neurosurgeon is telling you. That was essentially the vibe that Patty was getting. And it would be throughout this day following Michael's drain placement when they would give Michael so much medication in such a short period of time. They gave him 10 doses of morphine, 2 doses of oxycodone, and a dose of a sedative called droperidol. And these drugs were given over a course of 10 hours. Like, they just gave Michael so much drugs. It would be so hard to fathom not only how he was physically feeling, but how he was mentally feeling and thinking as well. And the issue with this is that it wouldn't be too long after when Dr. M would come into Michael's room, and while in this heavily medicated state, he would put this consent form in front of Michael, just telling him, hey, like, you need to sign this, like, to get this brain surgery done. Do you want to sign it? We are talking about somebody who just had a plethora of medications just after having a drain placed in his head. And this doctor thought that this would be the perfect moment to get a consent for brain surgery. And worst of it all, he got this consent from Michael without Patty or David or just anyone who wasn't in a post-operative and heavily medicated state being present. So that next day on Friday the 21st at around 3 p.m., Michael would be wheeled into this operating room to get this surgery done on his brain. And while this is happening, Patty and David would ask Dr. M, like, wait, how is he getting into the operating room? What about the consent? To which he would reply, oh, Michael signed the consent form the other evening. And so now they're just a little confused to find out that Michael had gone ahead and made this decision to do this procedure, especially without even mentioning this to them. They were such a tight-knit family. Any type of huge decision like this was something that the three of them would talk about and typically make as a collective. In particular, it was very unlike Michael to go through with doing something like this without even requesting to speak to his parents. And this procedure was meant to take 3 long hours. However, once 6 p.m. hit, 3 hours after Michael had been brought into the operating room, Patty and David were still left sitting in the lobby waiting for somebody to come out. 7 p.m. would pass by, nothing. 8 p.m. comes, nothing. And finally 9:30 p.m., 6.5 hours after they began this procedure, Dr. M would walk into the waiting area and approach the parents. And the first thing he would do was kneel on one knee, pull back his hat. He would immediately just blurt out, "This has been the worst year of my life." And so the parents who have just waited 6.5 hours for what should have been a 3-hour-long surgery would look at each other puzzled, and Patty would ask Dr. M, "How is Michael?" And he would just reply, "I found a little bit of matter, but I never found a cyst." And then he would go on to tell them that he thinks he may have accidentally punctured the cyst when going in with the drain, and that he sent this over to pathology, but actually finding the cyst intact was something that he did not do. Instead, he did some heavy manipulation of Michael's brain. Patty and David were in so much shock, they couldn't even possibly hear anything else Dr. M was saying. All they could think about.
Some Tinder dates end with a goodnight kiss. And some
possibly hear anything else Dr. M was saying. All they could think about is, where's my son and is he okay? And Dr. M would go on to tell them that not only had Michael been struggling to wake up, but that he would have to be in recovery for much longer than they initially expected. And it would be shortly after this conversation when Patty and David were finally allowed to head into the ICU to see their son. And when they would open that door and walk into his room, they would be absolutely shocked and horrified with the condition that Michael was in. Because when they would look at their son laying in that bed, all they would see was Michael's head wrapped up, and through the bandages, he was looking swollen like they've never seen before. His head was swollen, his eyes were closed shut, and he was just not looking well at all. And Patty and David were terrified because nobody had prepared them for what they would see when they came into his room. And they started thinking to themselves, like, is this normal? Is he supposed to look like this after a procedure? Regardless if this was or not, they knew deep down that something was wrong. And at this point, David would just look at Michael and just straight up say, "Patty, they really hurt him." This was the first time David had truly realized the harm they'd done to his son, and he was fully witnessing the extent of it. And they were just anxious to see if Michael would even wake up from this, because Michael's neurological exam would show that he had suffered some significant trauma to his brain during that 6.5-hour procedure. On this weekend, Dr. M was not in the hospital, which was strange considering he just performed the surgery and should have probably been overseeing Michael's care. But it was on that Sunday when the locum doctor who was covering for him would enter Michael's room and tell them that they needed to remove the drain from his head because it actually didn't drain much, if any, fluid. So at this point, the doctor started unwrapping the bandages from his head. And when they were done, Patty and David looked at Michael, and it was at this moment their heart must have absolutely sunk, because this was when they were able to see the full extent of what truly happened to Michael. Because when they looked at their son, all they saw clear as day was that part of the front of his skull had been removed and pulled back. It was at this exact moment they had realized that Michael had actually had a major procedure done called a craniotomy. And a craniotomy is a type of surgical procedure where a surgeon would remove part of somebody's skull in order to access their brain. In this moment, Patty and David were absolutely stunned because they had not been told that Michael would be undergoing a craniotomy. All they were told was that this would be in the top of his head. They would open it up a little and they were going to simply take out the cyst. Nobody told them that Michael's head would be completely cut open. And it would be after this realization when Patty and David just sat there in silence, just stunned, thinking about what was actually going on. They in fact sat there for almost 12 hours, not saying a word to each other, just complete silence, because they were shocked with the situation that they realized they're now in. This craniotomy was the last straw for them because they were never told that this would be happening, and nobody told them the possibilities that could happen if this procedure went wrong and they couldn't find the cyst. What was supposed to be an estimated stay of less than a week following a minor cyst extraction soon turned into Michael needing to spend the next few months in the ICU, and it would be during those months when Michael would just absolutely suffer through the worst health complications. Anytime he would recover from one life-threatening situation or complication, another one would just shortly pop up. And this was constantly happening throughout his stay in the ICU. Some of these complications included an intracerebral hemorrhage, recurring brain abscesses, hydrocephalus, pulmonary embolism, recurring MRSA infection and sepsis, intracerebral yeast infection, and respiratory arrest. And Patty and David would explain that none of these symptoms or side effects were described to them before he underwent these procedures. And it would be a whole 5 months that would go by with Michael in the ICU when the care team had decided to transfer him into a rehabilitation hospital. But this is where the most shocking things started getting revealed in this case, because it would be during this transfer when Patty and David would be informed that during Michael's initial operation 5 months ago, there had been an intraoperative heavy manipulation of the brain. And because of this heavy manipulation, Dr. M had not only performed a partial frontal lobotomy, but he removed part of the hypothalamus from Michael's brain. And these procedures were expected to be accompanied by some very serious chronic complications for Michael during this time. He would become 50% blind. He would have hemiparalysis, lose his short-term memory, have severe seizure disorder, have thalamic chronic pain syndrome, become severely immunocompromised, and he even suffered from hallucinations and psychosis. But the most ridiculous part of it all was that these were things that the ICU had kept from Michael's parents for the first 5 months of him staying there. Not only did the ICU not disclose any information about the intra or post-operative complications Michael could possibly face, but they didn't inform them about the expected chronic impairment that would come from a procedure like this. The family would instead find out about these complications while in the receiving rehabilitation center. Not once during their 5-month stay in the ICU were they told about any of this. And Michael would subsequently go on to spend the next 22 months in rehabilitation hospitals interspersed with constant readmissions for escalation of care in both step-down units and ICUs. And the day would actually come when Michael had gotten stable enough to finally be discharged from the hospital. But unfortunately, to their dismay, the joy from this discharge would not last too long, because it would be only shortly after when Michael would go into multiple organ failure. It was after this episode when Michael would lose the ability to walk, talk, laugh, eat, or even hug and embrace his parents ever again. And so Patty and David would bring him to the family house, which they had transformed into a home ICU, and they would be by his side to provide the most care to him while he was in this vegetative state. In this home ICU, they had installed a medical bed, Gallman lifts, steroid chairs, a shower chair, a bowel program, wheelchair ramps, and they even purchased a medically equipped wheelchair which was able to be used in van transport. They really just made sure that Michael would be able to live comfortably at home and have access to any and every kind of medical device he needed. But it would be also during this time when Patty and David would be in a constant fight with insurance companies, just pleading for them to help cover and support this quality home healthcare situation that they got all set up. For Michael's continuous care, he would need to get a tube in his windpipe called a tracheostomy. He would need a feeding tube in his stomach called a gastronomy, and he even needed a suprapubic catheter, which is a tube inserted in the bladder. These were all necessary for him because he had such limited movement following all of his complications. Additionally, Michael would not only need to receive daily injections, but he also needed to take 27 medications, which Patty would grind up to be administered to him through his feeding tube every day. Not only this, but Michael was just suffering from the most painful and debilitating side effects. The only way Michael would be able to get through the day was if he was given continuous doses of sedative medications. He had this really excruciating neuropathic pain, which people often describe as feeling like this shooting or burning ache accompanied by tingling, numbness, or a loss of sensation. And in addition to dealing with these debilitating physical side effects, Michael would also be suffering from the most cruel and immeasurable mental side effects as well. Michael's cognitive ability had actually been decreased to the level of a third grader. And around this time, he would only be able to raise his right hand in a sort of spasm in order to describe how he was feeling. And the things he was describing with his right hand were absolutely heartbreaking. Just a trigger warning of self-harm. There would be times when Michael would raise his hand to his head to imitate the trigger of a gun, implying that he did not want to be alive anymore. For months, this was an action that Michael would repeat multiple times on a daily basis. One day, Patty had traveled for a brief trip to Atlanta. However, when she arrived and got off the plane, she was sent a text that made her immediately turn around to head home, because it was on this day Michael had suffered from a complication so bad he needed to be readmitted to the hospital in the ICU. On that night, Michael had been in his bed, presumably about to go to sleep, but suddenly he started to seize as he was having an acute grand mal seizure. This is essentially the most visible and recognized type of seizure, as it's associated with uncontrolled convulsions and other muscle movements. But while Michael is in bed seizing, all of this would go unnoticed because the LPN who was working as what they call a night sitter for Michael had fallen asleep at his bedside and did not see that any of this was happening at all. And it would be shortly after the seizure when Michael had aspirated and developed a type of pneumonia. When Patty had gotten the message saying come home, she didn't even need to think twice. She was immediately on her way home because she knew that something must have been going on with Michael. And when her plane would land and she would get out of the airport, the first thing she did was head over to the hospital to see her son. It was while she was there, she would find out that Michael's temperature had been at an 80, and she would see David just sitting there beside Michael, reassuring him that she was on her way. He was just repeating to him, just hold on for mom, just hold on for mom. And Michael would go through the next few days on life support as his condition grew worse. At some point, Patty and David had to come to accept that Michael might just have to make the most difficult decision possible. He was going to decide if he wanted to stay alive or not. They told him that he has the options. He could either stay on life support or he could be taken off and pass away. Michael at this point was still unable to talk, but he was conscious. So they devised a system for him. They told him that if he wanted to stay on life support, to squeeze their hand once, but if he wanted to be taken off, to squeeze their hand twice. They did this for the next 24 hours, and Michael squeezed their hand twice every time, indicating his desire to pass away comfortably with them by his side. And it would be on June 4th, 2004, 32 months after Michael had gone through that initial procedure, when he would open his eyes to look at his parents by his side. And it was at this moment he would mouth the words, "I love you," before his eyes would shut and he would pass away at the age of 25. But that is most definitely not where the story ends, because it would be only after Michael's passing when Patty and David would find out information that would change this whole case. They had found out that in 1999, 2 years before Michael had undergone this drain placement and brain surgery, an article had been published stating that the procedure Michael went through wasn't even recommended as the first line of treatment for colloid cysts. The doctors who had published this article wrote, "We feel that endoscopic surgery should be considered as the first-line surgical modality for the treatment of colloid cysts. It offers the advantages of direct tumor visualization while being a minimally invasive technique." But what was so shocking about this situation was the fact that Dr. M, who was the one overseeing Michael's care, had not even brought this up once as an alternative option to treat this cyst. The Skolniks were not told anything about these less invasive alternatives. Dr. M would only go on to tell them that Michael's life needed to be saved and that the only way to be able to do so was doing this brain surgery. But while this may not have been the case, this kind of could show a clear example of a hospital or a healthcare provider treating this field as a business endeavor as opposed to the duty of trying to save lives. Providers want to make revenue and profit, and guess what makes a lot of money? Surgeries and procedures. So Dr. M going on to withhold critical information from this family could be viewed sort of as a way of trying to not lose this customer who would be making this expensive purchase from this procedure. But this wouldn't be the only news Patty and David had discovered about the surgeon, because they would soon learn that Dr. M had actually been substantially over-exaggerating his experience to them. He had initially described this drain placement and surgery as a walk in the park, a procedure that he's done hundreds of times before. But what Patty and David soon found out was that he had actually not performed this procedure hundreds of times before, but this was rather only his second time doing it. Before operating on Michael, Dr. M had only performed this procedure one other time. A stark difference from the hundreds of patients that he described he had done this on. And even worse of it all, they soon discovered that in addition to the lack of experience with this particular surgery, Dr. M actually had not one, but multiple suits of malpractice against him from other states. None of this information was available to them before going through with these procedures, and none of these risks or complications involved were discussed with them either. Informed consent is meant to be a two-way conversation where the healthcare provider ensures that they tell their patients and their chosen loved ones all of the risks associated with going through a certain treatment, letting them know what their options are or what could happen if they don't follow through with it or if they do follow through with it. Michael had suffered every known complication that could be possibly associated with a procedure like this, yet none of these complications had even been brought up to them while they were meeting with their providing surgeon. And because Patty and David hadn't been there when a heavily sedated Michael had signed the consent form for the brain surgery, they will never truly know what that conversation entailed. But what they do know is that the conversation should have never taken place, because no physician should be asking a patient to make a difficult decision when they're under such heavy medications just a few hours after an operation. What could be said is that this surgeon had been viewing this consent as a way to negate liability in case something went wrong. What could be happening a lot of the times is that one engaging in informed consent is viewed as a one-time event as opposed to a shared decision-making conversation with the patient and their families. But this story is why informed consent should never be an event. It should always be a process, because things change. A post-operative patient is not the same person they were as a pre-operative patient. Decisions are made much differently if one is in severe pain, or if they're heavily medicated, or even if they're extremely fatigued. In these moments, they're not able to think clearly to make such major life decisions like this. And alternative options and risks should always be disclosed to the patient and their loved ones. If Patty and David and Michael knew that there was a procedure that was recommended as the first line of care and that it was much less invasive, the outcome of this situation would have most likely been completely different. And the saddest part about this story is the fact that none of this even needed to happen, because it was concluded that the small cyst in Michael's head was not the cause of his symptoms. He did not need to go through a surgery to remove anything. When medical experts would review this case, they would just find a list of things that were done completely wrong in this situation, in addition to everything just mentioned. During Michael's 6.5-hour brain surgery, the family was told there would be 3 other staff besides the neurosurgeon who were present for this operation. However, What they soon discovered was that there had actually been another surgeon who was supposed to be present during the surgery, but this surgeon had actually refused to scrub in, as they didn't believe that there was any good reason Michael should have been undergoing such a surgery at the time. All of this was information that had been withheld from the family before and during Michael's time in the ICU. Trusting an authority figure like a physician is something that is so common for one to do, especially in scenarios like these when people are given such a short timeline for decision making under the pretense that the longer they wait, the more likely there will be a tragic outcome. And after all of this trauma, Patty and David would really be left to go through the next few years constantly thinking about how they could just blindly trust this man and how they could just agree to do so much of what he was saying. But this is where the conversation of medical transparency and power dynamics come into play. Like many others, this surgeon was dealing with this family while they were in possibly one of the most vulnerable states they've ever been in. It's so easy, especially in a state like this, to have trust in somebody who, based on all of their qualifications and all their experience, should be somebody who knows what they're talking about in a situation like this. It is so common for people to blindly trust others who are in a state of authority, especially when it's in an area that they themselves are not specialized in. You would think that after all those years of studying and all those years of practice and after taking the Hippocratic Oath to do no harm, that somebody like a neurosurgeon is somebody you can trust with your health and your life. But it's sad that in a case like this family had to unfortunately see firsthand and experience the lack of truthfulness and trustworthiness some doctors may actually have. If only there'd been an open conversation discussing the family's needs, their goals, what they wanted to get out of this, what was something they couldn't stand for happening, what were the other options, they would have been able to make a decision that best suited their needs and would have hopefully saved Michael's life. Even just before going in to meet with this surgeon, Patty had been doing her absolute best to make sure that this was the right call for her son. She had started looking for any information she could possibly find on this neurosurgeon, but to her dismay, there was no useful information she could find on this doctor. In fact, the only thing she really found was his name, rank, and serial number. But as time just kept ticking and the fact that the family didn't see any behavioral issues or signs that would ward them off from this doctor, they made the decision to just go through with working with him. So after everything that happened and finding out all of this new information, Patty and David would go on to not only leave a legacy for Michael, but to make sure changes in the healthcare system happen to ensure that this never happens to another family again. They would go on to spend the next few years tirelessly advocating for patients' rights, and they actually initially filed a malpractice lawsuit against this surgeon, but they would later settle this outside of court because not only did they think it was just best for their mental health to be able to legally put this behind them, but it was actually concluded by a board examiner that there was no wrongdoing found in this case, which we're going to get into. In July 2005, Patty had quit her job to start and lead her own advocacy group called Citizens for Patient Safety. And this group would prove to be very successful because it was on March 22nd, 2007 when the Colorado legislature passed the Michael Skolnik Medical Transparency Act, an act stating that important information, including cases of malpractice or any lawsuits that have arisen, must be listed on the public record of healthcare providers in the state. And surely enough, when this act was proposed, there was the select few of physicians who were quite defensive about having this law in pursuit. Many of these physicians were concerned, claiming that this law would make them the target of lawsuits, which is weird because it's kind of just like, in terms of lawsuits, wouldn't you feel more comfortable with patients knowing your previous history so that they can make a more informed decision before going through a procedure and finding out that you were not the most trustworthy doctor to provide that procedure? I don't know. But also, many physicians were actually up for this law being put in place. The Colorado Medical Society, which is the state's largest physician group, had actually been acknowledging this act, stating that it's critical that healthcare providers fully inform their patients or consumers. And with the help of them, alongside Senator Morgan Carroll, they were able to get this law put in place for the state of Colorado. The Colorado Regulatory Agency's department would post a vast list on their websites indicating the details that must be provided on a physician's track record. This includes things such as board certifications and criminal convictions for morally reprehensible felonies or crimes. Physicians would be required to complete these online questionnaires or profiles detailing any experience they've had that would allow patients to make more informed healthcare decisions, all of which were not available to the family before they proceeded with the operations that were done on Michael. And it would be shortly later in 2010 when this act would be expanded, applying this profile requirement to 22 additional additional types of healthcare or licensed providers, including dentists, optometrists, chiropractors, psychologists, and even social workers. This would be done through the Healthcare Professions Profile Program, or HPP, an online database ensuring that providers' information and licensing requirements are all up to date. So here's the surprising thing about the malpractice lawsuit. When Patty was interviewed about the situation in 2009, she declined saying his full name, as she said she was not out to destroy his life. And when doing my research, I did actually find the surgeon's full name, but the reason it's not mentioned much or focus hasn't been on him is because apparently at the request of the Skolniks, the Colorado Board of Medical Examiners reviewed the case, and they issued no sanctions as they found that there was no wrongdoing involved in this case. In fact, despite Dr. M having settled the Skolniks malpractice suit outside of court and having 2 other confirmed malpractice claims at other hospitals, the Valley View Hospital and many of Dr. M's former colleagues would actually describe him as an excellent neurosurgeon who had been unfairly targeted. Deb Weepking, the Valley View's old chief clinical officer, had actually defended Dr. M pretty hard, saying that in June 2001, before they hired him, they made sure to do an intensive hiring process to make sure he was well qualified to be a physician on their staff. And she would say, quote, "He's an excellent surgeon. He's been open and honest with the hospital, the medical staff. The hospital is very happy with what he's doing for us in this community." Also, the CEO of Valley View, Gary Brewer, at the time would too heavily defend Dr. M, saying that the hospital actually knew about his prior settlements before they hired him. But they hired him because he was just this exemplary physician who they claimed to be one of the best trained in the state. Many of his former colleagues would just talk about how he was one of the finest neurosurgeons they've had the pleasure of working with, and that he was just so intelligent and compassionate, and that Glenwood was so lucky to have a physician like him in the community. And many of his defenders would say that Patty just had this personal vendetta against him, despite the fact that from what I can find, she seemed to hardly mention his name anywhere really. But they would say how this was the case of a bad outcome of a surgery as opposed to Dr. M making a mistake. Some would even claim that Patty shouldn't even be granted instant credibility for the act just because it was named after her son. Dr. M would actually go on to say, quote, "I did my best to help her son. If she doesn't think I wake up every day thinking about Michael Skolnik, she's mistaken. Patty isn't the most objective person in this, nor am I, but state medical boards are there for a reason. Just because they didn't support her cause doesn't mean they're ineffective." But one of the main points Patty wanted to drive across was the fact that it didn't really mean much that he wasn't disciplined by the State Board of Medical Examiners, because apparently a statistic from the Center of Justice and Democracy claimed that 2/3 of doctors in the United States with 10 or more malpractice payments are never disciplined by their Board of Medical Examiners. Patty continues to spend her time traveling to different medical campuses across the country, telling Michael's story and raising awareness for patient advocacy. Because at the end of the day, her mission isn't to get back at this surgeon, but instead to ensure that something like this doesn't happen to another family. It's sad that it took this young man going through arguably one of the most cruel surgeries for a law to be passed stating that providers need to be fully transparent with their patients about any information that may be relevant to their history. While it's obviously true that there's a difference between a bad surgery outcome versus a doctor's mistake, this doesn't stop the fact that there was a plethora of information withheld from the family that would have allowed them to make a more informed decision. In addition to just the strange actions that occurred, including having Michael sign consent when he was under heavy medications, Patty would continue to do this work, keeping the promise she made to Michael that she would leave the medical field better than he found it. And they both have successfully ensured that Michael's legacy would continue to live on to save many other people's lives. But that is it for this case. I again would like to thank Fitmore for recommending this story. It's one that I actually did not know about, and I learned so much while researching it. Michael's legacy clearly lives on today because as long as I could remember, I've always seemed to be able to look up information about providers that I had and have proper open conversations with them about possible treatments to go through. And I know had this act not been passed, there could have been a good possibility that all of those conversations would not have even happened. But please let me know what your thoughts are on this story. Thank you so much for watching, and if you like this video, please consider subscribing so you don't miss any other stories involving medical cases, crime, and mysteries. Bye now.
That was my first Petal Palmer video I've ever seen, and let me just say, subscribed. I don't usually listen to cases about the medical field, especially ones that end like this, but I feel like I learned a lot. Not only that, I watched like Grey's Anatomy, Chicago Med, like things like that, so when they were talking about certain things, I understood certain things, which kind of blew me away because I'm kind of dumb. I'm kind of dumb when you think about it. With that being said, I hope you enjoyed this little Hannah reacts. I will see you on Friday with a video. Bye!